Welcome, Dr. Lana, to Conscious Conversations. I'm so excited to have you on to discuss all things birth control, the good, the bad, the ugly. I personally worked with Dr. Lana when I first came off the pill after 20 years, and I had really challenging side effects. So, as I went down my own journey to understand what was happening with my body, I learned so much about the pill, about birth control, about how it can affect our body and our mental health. So, this topic has been really controversial lately. And so, I'm just really excited to have this conversation and dive in with you. So, welcome, Dr. Lana.
Thank you so much. I'm really excited to be here. This has been a long time coming.
I know, Lana squared. So, before we get into the deep dive on birth control, I'd love for you to break down what exactly is naturopathic medicine and what type of schooling did you attend to become a naturopathic doctor?
Yeah, great question. I always knew that I never wanted to be in like a hospital setting per se. That's just something that's more sterile, not necessarily something that served me in my own health journey. I got into naturopathic medicine due to my own health issues at growing up, which was mainly gastrointestinal issues and anxiety, gut brain
Mm-hmm.
axis, which has a lot to do with what we're going to be talking about because
Mm-hmm.
endocrine system, the brain has a lot to do with obviously hormones and your GI tract. I found naturopathic medicine through my own journey and ended up enrolling in the school for it, the one in Arizona. We go through 4 years where we learn a lot of allopathic and or conventional medicine in the first two. So a lot of
Mm-hmm.
anatomy, pharmacology, physiology, all of those things. But the last 2 years, we really dive into nutrition, botanical medicine, physical medicine, all sorts of homeopathy, and a lot of really cool stuff that's more like hands-on and really more lifestyle perspective. So between conventional versus naturopathic, we don't have hospital rights except for in certain cancer treatment centers of America, which I think is pretty amazing. It's more of a private practice, more hands-on, and it's a lot more of helping patients have their bodies get back to homeostasis as
Mm-hmm.
opposed to just band-aiding with pills and medications. Every naturopathic doctor is a little different in how they feel about pharmacology. I am not anti-medication by any means. I think there's a beautiful harmony that can happen between the two fields, but I do think that there's a lot that can be answered and solved and understood and redirected and corrected through nutrition, supplementation, lifestyle management, as opposed to medication.
So let's dive into birth control. Why don't
Yeah.
we start with your stance on it as a naturopathic doctor?
I don't believe that it should be like the first line of defense for acne, first line of defense for painful periods. I think it's a quick band aid, almost like a penicillin, just like, here, take this. There's so many reasons why you have the painful periods, why you have the acne. Birth control is just going to band aid that until it is eventually removed one day for birthing someone. So to
Yeah.
me, I'm very much in the middle.
As somebody who was on it for 20 years, I very much have experienced what it's like. I was put on for acne and irregular periods. So 20 years removing it, as you know, with our time spent, that's really where the Band-Aid came off and all the side effects start. So,
Exactly.
okay, so let's get into it. Why do you feel it's been prescribed in the past for things like acne, cramps, or irregular periods?
I think a lot of it, like with the advent of the first, prescription of birth control. So that was in 1960, like height of women's lib movement, women's empowerment, all of that. I think that obviously when you prescribe, a lot of times when drugs are prescribed, you'll start to find off-label uses for it.
Mm.
Viagra, for example, that was a blood pressure medication at one point. And then they found out that it does so many other things, right?
Yeah,
And
yeah.
so it's used more so now for men's health. Same kind of thing with birth control, right? So with birth control, obviously they're trying to control births and have women have a little bit more freedom there. They found that it also helps to get rid of those painful periods, that acne. That was one of those things that doctors started to find almost as like um, an adjunct benefit for
Mm.
getting on that particular medication. And so, in my opinion, when something is awry and of something that can help it, it's just quick to have a quick fix, to just kind of be like, here, take this, right? Like take 2, call me in the morning, as opposed to,
Yeah.
why do you feel bad? What is happening? Instead of looking under the hood and doing that due diligence and that deep dive, here, take a birth control. It's just so much easier for people to kind of get people in and out. It's the way I feel like, in my opinion, the medical system is set up.
100%. That
Yeah.
makes so much sense. Okay. So many legs of this conversation, so many ways to go from, like, where do we start? Okay. So I'm like, okay. So I guess my first question would be, if somebody is experiencing things like acne and irregular and all of those issues, what would you suggest, or like what do you work with on patients instead of putting them on the pill for those reasons, if it's anything outside of contraception?
Yeah, I mean, there's like a myriad of ways to go with, let's start with acne, right? First and
Yeah.
foremost, for sake of the conversation and from your own personal experience. Acne, from what I see in my clinic over the past 8 years, is derivative of usually one of like 3 systems: stress and inflammation.
Mhm.
So cortisol, surprise, surprise. Second one would be through any sort of gastrointestinal mismanagement or imbalance. So that could be food sensitivities, it could be leaky gut, candida, SIBO, H. pylori. So many different microbial overgrowths and or deficiencies can have a huge effect on your skin. And the
Mhm.
thing is, your skin is the largest organ of secretion and excretion. So by the time something shows up on your skin, whether it's eczema, psoriasis, acne, rosacea, whatever it is, it's been in there for a while before it even makes it out to the skin. Like, you have to think about that. And the number 3, hormonal imbalance. So again, whether it's PCOS, any sort of hormonal imbalance in that right. So when a patient comes to me with skin issues or irritations or inflammatory skin conditions, acne, the first thing I do is I ask what kind of acne it is, where it's located, kind of when they see the actual eruptions occur. I ask those basic questions that need to be asked
Yeah.
for anybody that deals with acne. I think acne is incredibly underrated,
Yeah.
and incredibly kind of overlooked and pushed to the side. It does a lot for people's confidence. It does a lot for kind of
Yeah.
just making your way in the world. And vanity aside, it's just uncomfortable and it can be very
Yeah.
painful. Um,
Yeah.
and so for me, I always ask patients about their digestion, about their hormones in their periods, if they are cycling. And then, of course, about inflammation and all those kind of questions that can come up along with lifestyle. So I usually start with blood work, looking over
Mhm.
certain things when it comes again to sex hormones, cortisol, and inflammatory markers. And then we do all sorts of things. But I usually like to start with either hormone testing or even a stool kit, which tells
Mhm.
you so many things. And I'm so glad that I
Yeah.
can do those in my practice. So that's kind of
Yeah.
where we start with
Yeah.
our patient. Mhm.
God, I can so relate. I mean, I had horrible acne as a kid. It was just, I mean, I would call in sick like from school and try to go home when I was having a bad acne day. Like it was just debilitating at that age. So I so understand why so many of our parents put us on for those reasons, when it was like this miracle drug for that, because it really was so hard. And we didn't have the information to know that we can really do the work to solve this long term, knowing now that birth control is like a band-aid for those types of things. Acne, I envy these kids now that will have this information, that they'll be able to really access that and really work to solve it.
Yeah, actually, on that note, I did want to do a little shout out. Like, parents didn't know, you know what I
Yeah.
mean? Like, and
Yeah.
that's like one of the biggest things I think that my patients will get frustrated with. Oh my God, my mom put me on this when I was 12. Like, how dare her? She didn't
Yeah.
know. Number one, she's not a
No,
doctor.
of
Number
course.
two, like, she was just trying to make you feel better. Like, your mom was probably like, yes, come home. You're feeling horrible,
Yeah.
and so I'm so impressed with my patient base. It's a lot of younger women in their early 20s up to like early 40s. That's like the main demographic. But my young patients, I'm just so impressed that they seek me out, wanting to get
Mm,
off birth control and get like harness their own hormones and take their health and control back into their own hands. Like, that is so inspiring to me. I think I love my patients. And to be 22 and wanting to get off birth control and learn how to manage it and actually track their cycles and understand when they're able, when they are more fertile, so that they can kind of avoid sexual interaction
yeah.
during that time. Like, it's so impressive, the kids these days. Like, I think
Yeah.
it's amazing.
So true. Okay, so that makes sense. So if someone's having issues with acne or cramps or other things outside of contraception, there are ways to heal with food and supplementation and all of these different things that we can do naturally, which we'll probably get into more. Now, if someone does want to use birth control for contraception, which so many women do, girls in college or people that don't want to have children, and rightfully so, right? Everybody is entitled to do that. And let's say somebody doesn't want to take the birth control pill. What can people do?
And I have no problem talking about the Paragard with patients at all. So that's the copper IUD, the non-hormonal.
Hmm.
Um, it can do a few things. And it can have more painful periods. I mean, think about it. An intrauterine device, you're inserting something into a smooth muscle, uterine contractions and or cramping, that's your uterus contracting, that smooth muscle contracting. So during your cycles, sometimes when it's contracting anyway, to actually slough off that uterine lining or that endometrial lining for the blood to come out, your cramps can get worse because your body's like, there's a foreign object inside of my uterus, get it out. So that can happen with all types of IUDs. The Paragard, and I don't know why, but for some reason it can make the cramping a bit worse. Take hormonal imbalance and nutrient deficiencies versus cramping. Like, you gotta juggle one or the other. That's one that I always recommend to patients. And I really like this app called Natural Cycles.
Hmm.
It is basically, it's a fertility app that obviously you can use for birth control, and you could pair it with your Aura Ring, or you could also use like a temperature thermometer. It's a basal body temperature tracker that goes throughout the month, and it's actually quite fascinating, and a lot of patients love that. The thing is, you really have to be dedicated. So like most college students aren't going to be waking up at the same hour to take their basal body temperature, right? So
Yeah.
that's when I would recommend more of like an IUD. The one thing I will never recommend is the NuvaRing. That is shown, estrogen only. That has shown so many different, related to so many different issues with blood clots, especially in young, healthy women. That can do a lot of. There's just a lot of side effects with that one, and I've
Yeah.
heard a lot of bad stories like on firsthand from patients. So I would stay away from that one out of all of them.
Contraception. If somebody is really focused on that, then there's either you would recommend the IUD or tracking your cycles naturally. Would you never recommend the birth control pill? Is that notoriously the worst? What are your thoughts just like on the pill per se?
I don't not recommend it, but it's never my first line.
So people have options, right? And that's the good news. So I know from my own experience, getting off the pill was a bit of a nightmare that I was not expecting. So, acne, growing hair on my face. I mean, just food all over the place, many, many things. I know I'm not alone on that. There's been so many friends of mine that have dealt with that. And why don't we talk a little bit about why that can happen and also the pill can actually affect our mental health.
Yeah. I mean, you went through it, Lana. Like we've known each other for a
Yeah.
while now. I remember
Yeah.
getting anxious emails at times, and I was like, it's okay. We're going to work through
I
this.
was like, I want to die.
Alert,
Yeah.
alert. Yeah. I mean, and the thing is, I get that from patients often in like the early or the early, like before we get them off, people get very nervous. They're like afraid, like, oh my gosh, my friend got rebound acne. I'm going to get it. Right. Or my friend gained weight. I'm going to get it. Like everybody's different first and foremost. So
Yeah.
that's where we need to start. Now, part one of the question is why do those sort of symptoms happen? Is that correct? That was
Yeah.
question part
Yeah.
A.
Yeah. Per day.
Part A. That's because, again, when you go on birth control for something other than contraception,
Hmm.
usually it was from some sort of imbalance, right? So let's talk about the acne and like the hirsutism or hair on like inappropriate hair growth. That can happen like chin, jawline, nipples, happy trail, inner thigh. Like that's something that's obviously going to really affect a lot of women and their confidence levels, right? And intimacy, comfort. So that's more of an excess androgen state. Your androgens are your male sex hormones. Okay. So an exogenous hormone, for me, external, is shutting down that endogenous production. When that exogenous hormone is taken away, the feedback loop goes right back to where it was, usually. Not always, but usually. And so if you were doing that back in, when you were like a tween, like at 12, and you were having those issues, why would it be different just because the hormone was taken away or because you're older? Usually that imbalance was never really fixed in the first place.
Right. It was just Band-Aid.
Exactly. And so same thing with like cystic, really bad cramps, same thing. If you're blunting that endogenous with an exogenous hormone, when you take away that exogenous hormone, the feedback loop persists, right? And so that's one of the main reasons why that can recur and why it does so often. Post-pill PCOS or polycystic ovarian syndrome is something that we see in the clinic day in and day out. It is one of our top things that we work with. And that's when, again, you're getting off birth control. And then lo and behold, either acne crops up, and the acne for like PCOS or high androgen is more like jawline or like at the chin strap, like football chin strap kind of acne, where it's painful, deep and cystic, or you're having like those hairs. Mental health wise, the birth control pill depletes you of so many nutrients. Okay.
Mm-hmm.
Some of the biggest ones are all sorts of B vitamins. So like B2, B6, B12, a lot of different Bs, especially B6, I see a lot of. That's those are big. Mm-hmm. Vitamin D is another one that's affected by it. Zinc, all sorts of different things are depleted by the birth control pill. And the reason why they're depleted, glad you asked, is because when your liver needs to use those nutrients to actually detoxify, right? And not just detoxify the birth control pill, but to detoxify anything coming into your body on a daily basis. Your liver goes through so many nutrients and cofactors. And a lot of those are what the birth control needs to actually be excreted from the body as well. So let's say you're in college, you're going out drinking, you are eating really crappy food, you are taking the pill, and let's say smoking on the weekends, right? All of those things, your liver is working overtime. And when you take away birth control, your body is already depleted because it's using up all the B vitamins and all the magnesium. And when you take that birth control away, you're going to be so depleted that you can, not always, but you can experience that rebound more of depressive or a low mood, which is why in practice, we're constantly kind of flooding everyone's system with all those nutrients for about 2 months prior to actually getting you off birth control. And we did that. Right?
Yeah. We did. Yeah.
You got to, in my opinion, and you don't always have to, but we prep our people to get off just so you have that peace of mind. Because when you have that peace of mind, you feel more like you're in control and you have a partner in health. If you're just,
1,000%. Yeah. Because before I went, my gynecologist said, remove the pill, no worries, see what happens. And I mean, for fuck's sake, I removed the pill and it was a mayhem. And when I found the right practitioner, I understood that I had support. A lot of the conventional medicine, I was being gaslit because I was swollen out to here. I was dealing with mental health issues, and between the gyno and the derm, they were just telling me, no, it wasn't from the birth control pill. It wasn't until I met naturopathic and functional medicine practitioners where they were explaining no, this is just not being talked about enough. And so, I feel like having that support was life-changing. It was the only reason I had the courage to go back off after, have experienced that. I really want to hone in on the mental health piece because I think that's huge. And I think, so many of my friends and women I know have experienced it. I would love to dive into when we're on the birth control pill, why is our mental health potentially being affected? Because a lot of women on birth control are also on a Prozac or on an anti-anxiety, and they think it's unrelated, and it very well may be. But why, in your opinion, is it possibly correlated?
Yeah. So going back to what we were just talking about with the depletion of all those nutrients, so bees, egg, all those things are needed nutrients that get depleted from birth control. B's and mag, both of those are absolutely necessary for the production and proper functioning of neurotransmitters. So
Mm,
neurotransmitters, same thing as brain chemicals, right? So serotonin, dopamine, epinephrine, norepinephrine, GABA, glutamate, all those things. Glutamate's more
mm,
excitatory. The other ones I was mentioning are more calming, right? Calming or happy. So if you are going through all of, or if you're using all those different cofactors and nutrients to get rid of the pill or anything, like for your body to detoxify the pill and anything else you're ingesting or around or living around on a daily basis, environmental toxin wise, number one, that's going to be a big hit to your nutrient status, right?
mm.
Which again, your neurotransmitters need. The other thing that's huge, 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 and what you experienced for sure is its effect on the gut. Like
Yeah.
it has such an effect on your microbiome. And my heart goes out every time that I have patients that send me those bloat photos because it just looks like it looks so painful. And it
So
is. And when you feel just expanded and like an absolute, like you don't know why, of course it's going to spiral you, right?
yeah.
And so the fact that there's that bloat or that distension and that painful gastrointestinal discomfort that you can experience from having the pill in your system when you are deficient in certain good bacteria, or commensals, or keystone is what they're called.
Hmm.
Those good bacteria are so necessary for neurotransmitter production in your gut. They're so necessary for immune function in your gut, and they're so necessary for anti-inflammatory. And when
Mm,
you take away all those guys that are helping on a variety of different levels, it makes perfect sense why your nervous system and your mental health take a massive hit for some people. Not everyone,
yeah.
but for a
Yeah.
lot of people, it's a massive
A
hit.
lot of people. Yeah. So in summary, really the reason people can have issues with mental health is because the birth control pill is depleting them of the vital nutrients, uh, vitamins and minerals that their body needs, and causing inflammation and disrupting the gut.
Yeah, in summary.
Yeah. Yeah.
So
I'm like in summer. Yeah.
time
Wow. I mean, what? Are you guys
tying up.
hiring?
Yeah.
I'm like, I've been through it, so no, I I like am well versed in it, but I think it's just yeah, I think it's so important for people to have this information because it's so frustrating when we're just, looking for answers and yeah, I just really want to have this information for the masses. Okay, so also when someone comes to you and they are on the birth control pill and they would like to get off, so you'll help prepare them, like you did with me, a couple months before, so that when they remove it, you're mitigating the side effects, right?
Correct. That, and then I like to kind of talk about what had happened, like what's potentially going on internally, run those labs, and then let them know about 2 months we're going to do this. We establish a good relationship together, and then when they're off, we're very, myself and my nutrition team, we're very very in communication with these women. We want to make
Yeah.
sure that they hear that they feel heard, and that if they do have side effects, we can walk them through that. And so yeah, that's how we do it.
Yeah. So with food, with
Mhm.
supplementation, and with lifestyle changes.
Yeah, and that's some of the biggest things. I'm really glad you brought that part up. So when it comes to the nutrition aspect, there are so many different types of food that are going to be really, really, really helpful to support your liver during that transition phase. Fiber is going to be one of the biggest things because you're going to want to start excreting those excess estrogens that are kind of confused because they're just getting made again endogenously. You want to make
Mm,
sure that you're excreting those on a daily basis, that you're having enough water intake, that you're eating the right foods that are going to be giving you enough fiber, both soluble and insoluble. Additionally, you're not wanting to be blasting your adrenals during this time either with really high intensity workouts and really long runs and
yeah.
things like that. You want to be so kind to yourself during this transition. Doesn't mean you can't work out, but you got to
That
manage
was
it.
such a hard part. I mean,
Yeah, it was
I was
too.
waking up, drinking coffee, going to
Yep.
do a hit workout, and not eating till like 12 p.m. When I learned what that was doing to my adrenals,
Yeah.
that's like the one part that I always talk about at concierge is like why it's so beneficial to work with someone on it because you just learn these little tweaks. And at first you're like, I cannot change it. But I work out at noon. I changed my whole schedule, and not everybody can do that. But there are like a give and take, and there's things that we can do to help our specific body because I have friends that we've all had different side effects. My swollen belly, swollen like a balloon, some people didn't have. And so we all had a different way to heal from it. And I think that's why it's so important to work with someone like yourself so we can learn, okay, like what do I need to eat? What do I need to eat less of? What lifestyle changes are specific for me? And testing will give us the facts, the numbers, the
Yeah.
information.
I think what you just said as well was, what do I need to eat less of? That's
Yeah.
huge, huge, huge.
So if somebody comes to you and they really want to stay on the birth control pill or whatever form of contraception they're using, do you also work with patients and replenish the body of the depletion that's happening?
Yeah, 1,000%. I have so many patients that like, I just moved to the city. I want to live. Let's
Yeah.
go out on dates. I'm not
Yeah.
getting off
I
the
get it.
control pill. Of course, girl, go live your life. Like,
Mhm.
yes, we do that all the time. So we really like, it'll be kind of like a subsection within our wellness plan where it's like, this is what you're going to eat to continue to support your liver. This is the kind of stuff that you're going to be taking. Let's say you have, it's about to be like wedding season in summer, right? This is what you're going to be taking if you're going to have alcoholic beverages so that you can make sure that you're replenished with those nutrients that your liver is going through. Like there's different ways, again, just like you said, to tweak that we can help women who still want to live their lives and still want to be on birth control, but also want to be as holistic as they can while still having that medication.
What about the long-term effects? So there's a lot of conversation around fertility when we're taking it for a long time. I personally was on it for 20 years, right? So I'm always concerned and I'm doing all the healing work, but have you found that it affects fertility the longer you stay on the pill?
So if you're coming off the pill and you think you're just going to get pregnant like that,
Mm.
doesn't always happen that way. And you have to be mentally prepared for that. Your partner needs to be mentally prepared for that so that they're not stressing you out. Your mom, same thing. Like you don't want that external pressure on you because then that's going to raise your cortisol and make you feel less than. So when it comes to fertility, give your body, like usually we see the period come back within like 9 months if we're working together diligently on it within 9 months. Some patients that my other colleagues have worked with up to 2 years. It just depends on what your hormonal situation was prior to coming on birth control and then what you're doing on an active basis with your provider outside of working with your provider. So exercise wise, nutrition wise, all of that, stress management wise. That's what's going to guide your hormones back into balance. And so fertility wise, again, it's a lot to do with age. It's a lot to do with lifestyle. And the biggest thing I've seen is it does take time and it does require patience and understanding with your provider. That's not always going to come back at late.
I guess my last question would be in terms of tracking the cycle, do you feel like this is something we could potentially earlier on, like as part of school, like education, so that kids and teens are really like armed with this information so that it doesn't feel so burdensome? Like I feel like when myself included and other women have to learn this and learn that it can work, it feels like a burden. And maybe if we were to learn younger, it would just become like a natural part of life and a part of the conversation and a part of like our daily routine. Do you think that that would be something helpful? And can you elaborate on the natural tracking in case somebody just wants absolutely nothing to do with synthetic hormones and IUDs and all of the above?
Yeah. I could go on and on about this, so I'll try and keep it succinct. The
No,
answer
you
is
can go on and on. Feel free. This is important. This is like the important, I think, really
yeah.
important.
Yeah. Like the overall answer is absolutely yes. Like I have women mid 30s to 40s who don't know what day one of their cycle means. Okay. Day one is the first day that you bleed, like not spot, but have like a period. And that is so crucial to know, because how are you going to track your cycle if you don't even know how to count the days? And this is not me being negative towards these women, but they're not taught. This is not taught in school. This is
Yeah.
not taught in sex ed. And I think that's a massive, massive issue. Like, if I could redo education, I totally would. But for women to not even know what day one means versus when they ovulate and what that looks like and what those symptoms are, like it just blows my mind at the lack of sex education that we have as a society, especially in the United States, I believe. And
Yeah.
so, like, also when I say how long is your cycle, people will say 4 days. That's how long your menses is. Menses is your period, right? Like the actual blood, menstruation. Your
Mm.
cycle is from day one to day one, from the first day you bleed to the next month's first day that you bleed. That's a cycle. Your
Yeah.
menses is your period. Like, there's so many little, not even nuances, just facts. People are not taught, and it blows my mind. And they're very simple to understand the earlier you start. In
Yeah.
our practice, we educate all the time. So like I'm always pulling, like if it's a virtual patient, I always pull up like pictures online. Like I highly suggest Googling women's reproductive menstrual chart. Okay. And
Mm.
just seeing what the different cycles are. There's a follicular phase, which is the first part of your cycle, like days, usually in a normal cycle, which is 28 to 30 days. Doesn't mean that that's usually what it is, but that's a normal cycle. Follicular
Yeah.
phase is the first part of your period, days 1 through like 14, right? You're supposed to ovulate like 14 through 16. Ovulation is when the egg pops out of the ovary, goes on the fallopian tube to then get implanted into the uterine lining. Luteal phase is the second half of the cycle until the first day you bleed, okay? And that's going to be when you're getting, for most women, that's when you get more of that PMS symptoms and the hormones start to get more dysregulated. You could have androgen excess, again, the pimples or the hair. That could be when you have estrogen dominance, which is like more anxiety or cramping or cyst formation or things like that. There's certain hormones that dominate each phase of the cycle, right? And your menses is when all the hormones drop. And that's why the blood comes out, because
Mm.
everything drops, right? And your uterine starts to shed its lining. And then they
Yeah.
build back up. And then LH surges. There's ovulation. And then you have that build of estrogen and progesterone. Again, progesterone drops, and then you have that shedding of the lining. There's
Yeah.
so many things that occur during your cycle on a monthly basis that,
Yeah.
number one, are crucial for a woman to know, girl to know. And I
Yeah.
think, I mean, we just had Mother's Day. I think it's a great thing for moms to really start to teach their girls about this.
Yeah.
And also look at this is another thing. Women don't look at their period blood. It tells so much. It tells so much what the color is, the consistency. Are you clotting? Are you like,
Yeah.
all these things are so important. Is it brown? Is it black? Is it purple? Like your menstrual blood, especially from a Chinese medicine perspective, which I'm also trained in that's
Yeah.
huge. That's one of like the,
Yeah.
the vital signs that we learn how to ask women. So yeah, I could go on
Yeah.
for days about
I
this.
mean, I've also learned so much about like the spirituality of
Yeah.
the process and like how, when we are on these medications, it's really hard to be connected to our feminine essence because we're being run by like a synthetic machine. And so I mean, feminine energy is all about creativity, intuition. I mean, we're literally creating life as like a
Yeah.
portal, or have the capability to do so, whether we have kids or not. I mean, so there's the whole, conversation around that and tapping into all of that. And if we don't understand our cycles and we're not connected, then we kind of are missing the gifts, right, of being
Mhm.
a woman and all the beauty that comes with it. So I think implementing it in school and having mothers really understand it themselves so that they can teach their daughters in that way. Yeah, it's really more of a conversation in general and probably less prescribing of medicine, which with birth control and conventional medicine is an epidemic in itself. So
Yeah, yeah. The
yeah.
other thing I have, other thing, last thing, I think that it's asking for a tampon is so shunned for like middle schoolers
Yeah,
and
we're
high
like
school. Like, do you have a tampon, pull it up the sleeve. Like, no,
just
walk,
sleeve.
like you don't
Yeah.
sleeve.
Wave it around.
That's what I do at this point. I verbally, like, I've been in a Pilates class. Does anybody have a tampon? Somebody's
Yeah.
going to help you. Some
Yeah.
woman's going to be like, of course I do. Like, to me, destigmatizing what happens to literally every single female on the planet, on the face of this earth, is so
Yeah.
important. And to sit there and be ashamed that you're bleeding, which is a
Yeah.
beautiful process once you get off birth control and you understand your cycles, and like you feel the different hormone surges. Like, it's actually, if you can
Yeah.
hold it, it's beautiful.
You feel,
Um,
I feel so much more connected to my
mm,
intuition, to like being, yeah, a woman. It's
mhm.
crazy. But I mean, then there's the whole tampons, there's a whole conversation of like which ones are non-toxic, but we'll have to get into that another time.
Next time.
Next talk. Okay, to summarize for anybody who made it this far, it's just that it's overprescribed for things that we can actually solve versus putting a band-aid on it for things like acne and cramps and balancing hormones. Those are all things we can actually solve. So there's just an overprescribing of it. And the second part is the reason it causes issues in the body or mental health wise, is because there's a depletion of these really vital nutrients, supplements, vitamins and minerals, and gut dysbiosis. The other thing is there's not a lot of information on how to track naturally. So that would probably prevent a lot of people from using contraception if they don't want to and they feel like they have to. So more education, naturally tracking our cycles. And then lastly, how we can heal when we come off of it, how we can really help the body and mitigate side effects and work with somebody who really knows how to be a companion. It really feels like a companionship when the person, I'll speak for myself, when I'm coming off of it, we don't have to go through that hell. And so for anybody who is interested in more information or wants to go through the process themselves and work with somebody like yourself, what is your Instagram?
Dr. Lana Wellness. So DRLANA Wellness, or my personal is Dr. Lana Butner, BUTNER.
For any information on all things wellness, please contact at your conscious concierge to learn about what your options are in the world of wellness and healing.
I appreciate
Thank
you.
you so much. Thank you so much for coming on.
Of course. Thank you for having me.